Hi everybody, we're back for the second module of the cardiovascular system. This one is about blood clotting, also known as hemostasis. Okay, don't get that confused with homeostasis. And so we're going to talk about what initiates the clotting process, the steps of the clotting process, and then how to get rid of clots when your vessel gets all fixed up. Okay, the word hemostasis means to stop bleeding, and hopefully the why of that uh, is pretty obvious to you, right? Of course we want to stop bleeding because we don't want to lose blood. Even more, that is a hole where blood is coming out, and we don't want pathogens to get in. So we need to maintain our blood volume, plug the hole so blood doesn't come out, and we need to protect ourselves from disease, so plug the hole so bad stuff doesn't get in. And of course, until you stop the blood flow, you're not going to be able to fix the vessel. I mean, you don't fix your pipes without turning your water off, right? So we got to stop the bleeding for all of these things to happen. There's basically 4 steps to stopping bleeding. Number 1 is called the vascular phase. Number 2 is the platelet phase. And then the third one is when you're actually going to coagulate the blood and initiate that clot formation. So the next few slides are going to talk about these in order. So the vascular phase is just a few seconds. The blood vessel will spasm and squeeze, it's a reflex response, and it shows that there when you cut through one. And obviously this works to nearly stop blood flow completely if the vessel is really tiny, like a capillary. But this isn't going to hold long enough to prevent blood flow without a clot forming, especially in a bigger vessel. The second step is the platelet phase. The platelets get sticky because of the injury, and they'll start to stick to the edge of the cut. Again, it's not really a clot, but it can slow down the blood from leaking out a little bit. Then there's the coagulation phase, and this one is much more involved. There's lots of different clotting factors and mediators involved here. It's a step-by-step cascade-like process, and it can be initiated either from something external, like something cuts you from the outside, like a razor blade or something, or it can be stimulated from an internal factor, like somebody gave you the wrong blood type. It could initiate the clotting process. If it's from the outside, it's called extrinsic. If it's from the inside, it's called intrinsic. But it doesn't really matter. Both, by the end of the cascade effect, gets to the same spot. And the same spot, this common pathway here in the middle, is basically prothrombin, a protein that's in your blood, will be converted into thrombin. That enzymatic step is kind of the end or the result of either the extrinsic or the intrinsic pathway. And then thrombin itself is an enzyme which converts fibrinogen into fibrin. And if you remember, fibrinogen is one of the plasma proteins that you always have floating around. And fibrinogen is dissolves in the plasma, so it floats around as a dissolved substance. But fibrin is a solid, so it comes out a solution. Maybe you've done a chemistry experiment when you put 2 liquids together and a solid comes out. It's kind of what happens. And the fibrin are these sticky solid sticks, something solid, and everything gets caught on it. The platelets, which are sticky, red blood cells, essentially forming the clot. Okay, so the coagulation phase is all these reactions that are occurring to get to that prothrombin converted to thrombin and thrombin converting fibrinogen into fibrin. It's a 2 enzymatic step. Factor X is absolutely required for this to happen. Factor X is one of the clotting factors, and they're numbered with Roman numerals, and were numbered probably in the order of discovery, not necessarily in the order that they're used. But these clotting factors are made in the liver. We'll talk about that in a minute. And you absolutely need factor X to have that last step, prothrombin to thrombin converted, to initiate the coagulation and the clot formation. Okay, so here's another example. You get a broken blood vessel, and the all these steps start to occur. It's going to spasm and the platelets might aggregate. But factor X then converts prothrombin into thrombin. Okay, you can see that over here on the right side there. Prothrombin is converted to thrombin. It's an enzymatic step requiring clotting factors, particularly factor X, calcium, and prothrombin activator, which is part of in what's in platelets. And then thrombin is an enzyme that converts fibrinogen into fibrin. That forms the clot because fibrin is a solid. Here's another really pretty picture I found online somewhere. Again, the clotting factors, factor X, calcium, all of those things being released because of you damaging the blood vessel converts prothrombin into thrombin, and thrombin converts fibrinogen into fibrin. And that fibrin catches the red blood cells, the platelets, forming a great big clot. Hopefully plugging your blood vessel so again, you don't lose blood and pathogens can't get in. Here's another one I robbed from the web, which the whole website said don't rob this picture because it's copyrighted, but it's just a really cool picture. The yellow there is the fibrin netting kind of forming during the clot process, and you can see the platelets in blue and the red blood cells in red there are getting caught, forming that clot in the blood vessel. So credit to Dennis Kunkel who did this. The credits are in the notes version if you want to see that. There is a great video. If you look at the regular PowerPoints, you can click on this. It's about 10 minutes long, but it really does a great job of explaining this, especially if you didn't understand mine. So go check that out. Now, the clotting process is one example in the human body physiology of the positive feedback system. A clot will continue to form bigger and bigger and bigger until the whole thing, the whole vessel is blocked. Obviously, you don't want a half a clot. You want to stop the blood flow. So it's a positive feedback system rather than negative, which is most of the stuff that we've been talking about so far in the different body systems. Also, the faster blood is moving, the harder it is to clot. So think about that. The opposite is true too. Slow moving blood is easier to clot. So if you sit a long time, like in an airplane, and your blood pools somewhere, it can initiate the clotting process, which is pretty dangerous because you don't want clots floating around and getting stuck somewhere and blocking blood flow. Sometimes they'll cool people during surgery to slow down blood flow so that you don't bleed out when they're cutting through vessels to get to whatever they're operating on. But they also worry about clot formation because they are cutting vessels. And so they might give you blood thinners or do those little compression things on your legs to keep your blood moving so you don't have spontaneous clots form. Also, you're not going to clot very well if you don't make clotting factors. People who have hemophilia, basically it's a genetic disease that prevents the production of one or more clotting factors. Sometimes they're called bleeders because when they get cut, they bleed a long time because they don't have the proper amount or kinds of clotting factors. You also need vitamin K to make clotting factors. So those green leafy vegetables that you don't like very much, or broccoli, has a lot of vitamin K. So you need to have vitamin K in order to make clotting factors. Clotting factors are made in the liver. Once you make a clot, of course, once the vessel is fixed, you want that clot to go away. You don't want it to get loose and go get caught somewhere else. It will naturally start to shrink as the vessel repairs. And that's good. You have some natural chemicals in your blood that are produced, plasminogen and TPA, that help break up clots. We can mimic some of this. TPA is an anti-clotting drug that they can give to people who have strokes due to a clot within 45 minutes and pretty much reverse the damage. It's a very, very expensive drug. They have genetically modified a goat to produce this. Because it's so hard to make synthetically in the lab. So it's kind of interesting. They also have blood thinners they can give people to help break up clots. Heparin is probably the most common, but there's Coumadin, warfarin. In fact, rat poisoning is warfarin. And when you put the poison out, the rats eat this, and then when they jump around, they break capillaries inside and bleed to death. So it's a way that we use to kill rats, actually. We also have names for clots. Clots that get caught in a tissue are called a hematoma. Clots that get caught in blood vessels are called thrombuses or a thrombus. Clots that are moving around and get caught somewhere are called embolisms. Okay, so if you had a blood clot form in your leg, if it would stay there, if it's in a blood vessel, it would be called a thrombus. But if it starts to move around and get caught in your lungs, it can be sometimes called an embolus or a pulmonary embolism, which can kill you within minutes. It's very dangerous. My dad, after he came back from a trip from Australia, he sat a long time on an airplane, and he's older. He basically started to be short of breath, and he went into the emergency room, and he was diagnosed with pulmonary embolism, and they gave him tons of heparin, but pretty much just watched him, because if they got loose and blocked too many of his bronchial tubes, it could have killed him. It was kind of scary. Here's a picture, actually, of a thrombus that got caught in a coronary artery of the heart, which is not good, of course. You don't want to restrict blood flow to your heart muscle. Here's a pulmonary embolism. People who are immobilized for weeks or lay down and don't move. This way they get you up, for example, after surgery, after a hip surgery, get you up and move you around, because remember, slow moving blood is more likely to clot. There are a couple of blood disorders you should know a little bit about. Remember from the first module, anemia means you don't have enough red blood cells to carry adequate oxygen. Most common reason for this problem is lack of iron, but there are multiple reasons for it. Sickle cell anemia is when there's a mutation that makes the red blood cells form a wrong shape, a sickle shape instead of the concave donut. Hemophilia is when you lack blood clotting factors. It's an inherited disease. Septicemia, by definition, is when a pathogen is found in the blood, particularly bacteria. Blood should be sterile, so never a good idea to find bacteria floating around in your blood. Malaria is a disease carried by mosquitoes. It's a protozoa that gets into the blood when the mosquito bites you, and the protozoa causes your red blood cells to rupture. Never a good idea. Leukemia is a blood cancer. Basically, your bone marrow starts to make a whole bunch of white blood cells that are useless. They're mutated, but then that prevents the synthesis of normal platelets, normal white blood cells, and normal red blood cells, leading to all kinds of problems. If you don't have enough red, you can't carry oxygen. If you don't have enough white, you might not be able to fight off infection. And if you don't have enough platelets, you might bleed. So leukemia patients have lots and lots of symptoms depending on which one hits them first, but without treatment, it can kill you very, very quickly. If you want a little bit more information about the blood clotting process, check out this YouTube. Otherwise, use your textbook. It's a great source of information, or ask me.